To assess suitability for weight loss, we use a tool called the Body Mass Index. This is available on your app, on the internet. You can work it out yourself. And what this means is that once you've worked it out, you'll be able to guide yourself towards where you are, whether you're overweight or not. A BMI of 20 is considered normal. A BMI of up to 25 is considered overweight. And once you get to a BMI of over 30, you're obese. There are a number of different procedures available to help patients lose weight. A well-established operation is called a Roux-en-Y gastric bypass, and there is also an operation which is very similar called the mini gastric bypass. Both of these procedures work by reducing the stomach size and also by bypassing some of the intestines, particularly the small intestine, which is necessary for absorption of nutrients. And when this is bypassed, then some of the calories that are going through the gut cannot be absorbed, and therefore the patients will lose weight. There are some preparations that have to be done in order to first assess their suitability and secondly prepare them for the surgery. The assessment requires a consultation with a specialist surgeon, and sometimes it involves a dietitian and also a psychologist as appropriate. Once the patients are deemed suitable for this type of surgery, then prior to them coming in for the operation, they need to be on what we call a liver shrinkage diet. After the surgery, there have to be a number of changes that are required for the patients to get a good result. The first thing is there has to be an obvious change in their lifestyle in terms of improving or increasing their level of activity, and also watching the types of different foods that they eat. There are multiple benefits to losing weight, and these relate to your overall health and the long-term risks of getting diseases like cancer, type 2 diabetes and other heart-related diseases. All the operations are carried out as keyhole surgery, which is tiny little cuts are made in the abdominal wall, and cameras are placed inside and the procedures are carried out. Most patients will spend between 1 and 2 nights in hospital. All these operations, once they are performed, it takes about a week for the patients to recover from the soreness of these scars, and then another week where they start to mobilize and get back to normal activities. So overall, I anticipate a patient will require between 7 to 10 days off work.